The purpose of this section of the video is to demonstrate the preparation of autologous platelet concentrate, APC Plus, using the Smart Prep 2 platelet concentrate system. The equipment needed to produce this product consists of a microprocessor-controlled Smart Prep 2 centrifuge system, a convenient workstation, a red reusable counterbalance weight, and disposable APC Plus procedure pack and applicator kits. The APC 20 disposable processes 22 milliliters of anticoagulated whole blood, yielding an APC product of 3 milliliters. Each disposable kit comes with everything to draw and process the patient's blood. Efficient and cost-effective liquid and spray applicators make product delivery easy and predictable. During the preparation for the blood draw with the APC 20 disposable, one approach is to load the syringe with 3 milliliters of ACD. Place 1 milliliter into the plasma side of the process disposable marked by the white port. This added ACD in the disposable aids in platelet resuspension. The other 2 milliliters of ACD remain in the syringe and are used for the patient blood draw. You can also use the 3 milliliters syringe provided in the kit to load the 1 milliliter of ACD into the plasma chamber of the process disposable marked by the white port. When the process kit is opened, transfer the wrapped sterile cups to the surgical or sterile field. When loading the blood, transfer the total blood draw syringe volume into the blood chamber marked with a red port. Place the filled process disposable into the Smart Prep 2 system in the appropriate orientation. Insert the reusable balance weight with the red label into the opposing rotor trunnion. Failure to use the balance weight will result in an imbalance and the centrifuge will automatically shut down. Ensure that the process disposable and balance weight are completely seated into the rotor trunnion. Close the lid securely. Press the green Start button located on the front panel of the Smart Prep 2 system. The Smart Prep uses an automated dual spin and decanting process coupled with a self-calibrating floating shelf technology to automatically optimize platelet recovery. During processing, the red blood cells begin to pack underneath the floating shelf. The floating shelf rises to just below the buffy coat red blood cell interface. The centrifuge then slows, allowing the platelets, white blood cells, plasma, and a small amount of red cells to automatically decant into the plasma chamber. The centrifuge then accelerates, which results in a pellet of platelet concentrate at the bottom of the plasma chamber. The entire process to separate the whole blood into red blood cells, platelet-poor plasma, PPP, and autologous platelet concentrate, APC Plus, is completely automatic and completed in approximately 14 minutes. The display on the front of the Smart Prep 2 system shows the remaining processing time in minutes. An audible alarm will sound once the cycle has been completed, indicating that it is now safe to open the lid and remove the process disposable. The blood chamber of the process disposable contains the packed red blood cells. The plasma chamber contains the platelet concentrate, a button-like precipitate, and platelet-poor plasma, supernatant. Avoid tilting, dropping, or shaking the process disposable, as this can prematurely mix the separated components. Place the process disposable in the disposable holder located on the Smart Prep workstation. Using aseptic technique, take the plasma syringe with blunt cannula and white spacers and enter the white port of the plasma chamber. Push the cannula down until the white spacer guide is firmly seated against the white port. Withdraw platelet pore plasma volume from the plasma chamber until air enters the syringe. Approximately 3 milliliters of plasma and platelet concentrate will be left behind in the APC-20 process disposable. Transfer the recovered platelet pore plasma into the yellow cup located in the surgical field. Following the removal of the platelet pore plasma supernatant, the platelet concentrate is resuspended in the remaining platelet pore plasma, resulting in a very concentrated autologous platelet concentrate enriched with growth factors, APC+. To resuspend the platelets, use the platelet concentrate syringe with blunt needle and no spacers to withdraw the remaining platelet pore plasma. Gently inject it back into the plasma chamber. Do not use excessive force so as to avoid foaming and platelet activation. Repeat this process 2 to 3 times until the platelets have been visibly resuspended in the plasma. Withdraw the total volume into the syringe. Observe the base of the plasma chamber to confirm that all of the platelets have been resuspended and withdrawn into the platelet concentrate syringe. Transfer the recovered platelet concentrate into the red cup located on the surgical field. Avoid excessive force when transferring the platelet concentrate.